Let's slowly get started. Okay, welcome everyone. Thanks so much for tuning into Insomniac's chats. Not an actual chat with an insomniac today, but I'm joined today by Kristen. She's a sleep apnea specialist. And if you'd like, actually, Kristen, you can actually introduce yourself for us. What better
Sure.
way than you?
So I am actually by training a dentist, but I became a sleep coach after I dealt with some sleep issues myself. So my specialty is treating sleep apnea through oral appliance therapy and different adjunctive therapies to help people breathe better so that they can sleep better. But I see a lot of people coming in with insomnia in my chair.
Mhm,
So I there's a lot of overlap. So
mhm.
I don't diagnose insomnia, but I see a lot of people with insomnia in my chair.
Yeah. Yeah, it's like so interesting because we've been following each other's like content and I definitely see that there can sometimes be a little bit of an overlap. A lot of like what I specifically speak about is just more like the relationship that we have to sleep. But I
Mhm.
also want to be mindful of the fact that it all isn't always like this mental barrier, right? Like it's not always just like this fear of wakefulness that may cause insomnia, but it also can be like physiologically like specific reasons of like why we're not sleeping, which is why I'd love to speak to you today about your own perspective. Like maybe you can deep dive a little bit on sleep apnea specifically. What is it for maybe anybody who doesn't know, how it's actually maybe detected if people think that they may be experiencing this versus insomnia. So yeah, I guess the floor is
Yeah.
yours.
Okay, sure. And jump in anytime if there's anything you want me to like elaborate on or if you have any questions.
Sounds good.
But I will say that a lot of us like don't necessarily know that our issue is breathing related. Like for me, I thought I slept okay. I knew that I like tossed and turned a lot and I woke up with like massive anxiety, but I didn't know that it was a physiological thing going on in my sleep. So just to kind of like back up a little bit, sleep apnea and similar things mean that you're not breathing well when you're sleeping. Like for me, I didn't have apneas all night long. I had these other things called hypopneas. So breathing well, I think of it like if you have a faucet and you turn it on, water is flowing through, right? If you turn it off, that's an apnea.
Mhm.
If you turn it on just a little bit, there's water dripping down through. That's a hypopnea. Okay, so for me, I was having hypopneas all night long. And what happens when you have that struggle to breathe? Your body's like, what's going on? So who's chasing me? What's happening? And your brain stays activated. So you stay in this shallow state of sleep all night long, and you're never really getting into like a deep rest or REM sleep. So I didn't know that I was like my brain was waking up so much in the night, but my body knew. And so I would wake up with
Right.
headaches, anxiety, exhausted. And that's pretty common. A lot of people don't necessarily know that they're waking up a ton, but it is common for people with sleep apnea to wake up a lot in the night and they don't realize that it was their breathing that
Mhm.
woke them up. But sometimes they might wake up with like this like heart racing feeling. And if we were to do a sleep study, we would see, oh, they stopped breathing, their oxygen dropped,
Mhm.
their heart's racing, and then they woke up and they're like, huh, now I'm awake.
Mhm. Mhm.
So it's interesting how sometimes it is something physiologically causing you to wake up, but you don't necessarily know that. You might wake up and be like, oh, I have to pee, but you
Right.
woke up because you weren't breathing, and oh yeah, I guess I could pee. So it's very interesting, and I feel like especially for women, a lot of us don't get sleep tested for these things because there's a very outdated kind of model of what sleep apnea is, being like older, overweight, and being a man. And more and more, I'm trying to spread awareness that women have it too. It's super common in women, especially women who look like me. And a lot of women who have clenching and grinding of their teeth, headaches, anxiety, jaw pain. Those are like big red flags to me.
Well, it's so interesting. Yeah, I think I personally had more struggled with insomnia, but I also classify into all of those things. Like I clench my jaw at night, I wear like a plaque. I have quite a lot of anxiety at times. Like I've now learned to manage it, but it is just very just like interesting to like know that you can have these like wake ups and that maybe even then can actually be paired with what I personally see as insomnia, right? If you're experiencing these like common wake ups and you don't know why, but then you start to see this as like alarming, then it can almost be like a hand in hand of like, okay, well, you are perhaps experiencing these issues with your breathway, and the breath specifically, but then also once you start reacting to them poorly, it can actually lead into multiple different problems and not just one alone.
Yeah. So, yeah, we see it a lot. And for some people, it's not like true apneas. Like for me, like I said, I was having just like I was breathing through a straw all night long, not breathing full deep breaths. So you may not show up on a test as having sleep apnea, but there's something else called upper airway resistance syndrome, which is
Mhm.
super common in women, which is just some resistance, something's collapsing in the airway. And it causes that fragmentation of sleep, even though you don't have sleep apnea. And that
Mhm.
fragmentation of sleep is where we get the anxiety and the headaches, and your memory's not working right. Um, just the brain fog kind of feeling because you're
Mhm.
not getting those REM stages and things like that. So,
Yeah.
a lot of women might go to a doctor or get a sleep test, and they're like, "Yeah, it's not sleep apnea," but they're like, if you were to dig into it, there's definitely things we could optimize on the physiology side that could
Mhm.
help with that feeling of insomnia. Um,
Mhm.
so it's interesting. We're seeing a lot more on this now, which is great.
Mhm.
A lot more awareness on this stuff. And sometimes too, it's the mouth breathing. So
Mhm.
you might see a lot of stuff now with like the mouth tape and like all that trendy stuff, which is good. I'm glad it's getting out there, but I wouldn't say that's like where I would start
Mhm.
um, with any of
Where
this.
would you start then?
So our bodies want to breathe well
Mhm.
through our nose. Okay,
Mhm.
that's the default system. And when you're breathing through your mouth, that's a backup to your body. That's like, what's wrong? What's happening? Why am I breathing through my mouth? That's not the way I want to breathe. So it puts you in that kind of like hyper vigilant, hyper alert state without even realizing it. So
Mhm.
before you start taping your mouth shut, you've got to make sure you can breathe well through your nose.
Yeah.
So that's where
Mhm.
good nasal hygiene, maybe a nasal dilator, things like that, working on the habit of it and breathing well through your nose first before you start just like taping your mouth shut. So for some people,
Mhm.
if they're like, I don't know if I do, if you wake up with kind of like that sore throat feeling or dry mouth in the morning, um, those are maybe some signs that you might be.
Mhm. You kind of mentioned that the sleep studies don't really go into this in that much depth, like even though there may actually be an underlying issue. Like if somebody has had a sleep test and it's come back normal, but they're still like maybe not fully convinced that it probably is, like what would be your suggestions for people like that? Because I think it's like so easy for the medical like side of things to always just discredit everyone, be like, oh, it's in your head, or like here's a sleeping pill, when in reality there may be other like holistic approaches that would really help you. So for those people that kind of fall through the cracks, like what would you suggest?
Yeah, so I see that a lot, especially because the home sleep tests they're really more of a breathing test.
Yeah.
And they underestimate everything like massively. So if you show up on a home sleep test as mild, you probably have like more going on.
Right.
Yeah, that's where digging into the details and like understanding a little bit more of the data is important. And just looking at one number of a score, a sleep apnea score, is not working well because some of these other things, like I mentioned with the upper airway resistance, they don't go by the same scoring system. You have to go by what the person's telling you and how it lines up with their sleep test. So unfortunately, there is a lot that can be missed there. And you do need to have someone that can help translate what's going
Right.
on. And having the diagnosis is like only one piece of the puzzle, right? So we just need to help people optimize what we know helps with good sleep, which is good nasal breathing and all of the other things that we talk about. So
Hmm.
if they're having all these symptoms, but it doesn't quite line up, you can still treat like a lot of the same things. You're not going to put them on a CPAP, but you can still make them an oral appliance to open up their airway better. You can work on good nasal
Hmm.
breathing. You can work on maybe they sleep better on their right side or whatever the test shows. Sometimes it's a positional thing too. So we can still work on like the physiological parts, even if it doesn't show up as true sleep apnea, and then see from there. And then I've had some people where it's a combination of both. Like they have moderate sleep apnea, but they also have another component of insomnia. Like one of my patients, she used to work a job where she was on call all the time, like in the night. So she had that association, when she would go to bed of that fear of like, I'm going to get called.
Hmm.
Once we could control the apneas and she worked with somebody on that insomnia side of it, that's when the magic happened. But we needed both pieces. So what
Hmm.
happens a lot of times is I see people in my chair who are being treated for insomnia, they're on sleeping pills. They never had a sleep test. And that's terrifying to me because we're depressing their respiration even more. And that's not really
Hmm.
helping them. They're not really getting good quality sleep. So it's really important to me that if people are having sleep evaluations or working with a sleep coach, that they're screening for these things so that those
Hmm.
people aren't just being thrown, sleeping pills or feeling frustrated that they're not getting better when maybe there's like that little puzzle piece that we just need to work on.
Yeah. No, I think that's like just so valid because a lot of everybody that I pretty much speak to, like their first like line of defense or like the first kind of like initial thing that they always try is medication, actually. Like the first thing that a
Yeah.
doctor will prescribe. When I personally was going through it, I didn't really want to go on medication straight away. So I received a kind of extended time off of work because my doctor thought I was burnt out, which is also ridiculous. And then I also went on sleeping pills, which is just, it's
You
ludicrous,
did they sleep test
really.
you before you went on sleeping pills?
No, 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 nothing. It was just like a GP.
I
And
don't
I had never
understand
had
that.
issues with sleep. Yeah, I know. Like I think like a sleep test was it was kind of like on my radar, but I live in Germany. And it's one of those things where like there is a bit of a barrier sometimes. Like to then have to for me, I don't really speak the language.
Mhm.
And I think that sometimes these like sleep tests aren't just easily available if they're not under like your insurance or like they're not in the same city where you live. And that I remember being the case for me. And this kind of like the first thing that the doctor said was just give me sleeping medication.
Yeah, that's very common, and very frustrating, especially because now the home sleep tests are like really easy and they're not crazy expensive. I there's a company that's working on coming into the US that I think they have a lot of European doctors, and they just mail it to you from your house. So like we're getting there. I think it's like becoming more accessible, but I
Hmm.
really feel like just like women have to get a mammogram when you're like 40, 50, everyone should need to get a sleep test. It's my
Yeah.
feeling
Yeah.
because we can catch some of these things and treat it and prevent a lot of other issues.
No, 100%. And like for just like some small like tips that maybe you can provide kind of like the general population of like how they could already like improve the quality of their sleep through like their breathing habits, what would those be?
Yeah, absolutely. So there's so many things we can work on, but I would say definitely starting with seeing if like can you breathe well through your nose? Like close
Yeah.
one nostril and just kind of test it and see because there's different like breath work things you can do to clear out, like doing alternate nostril breathing and things like that
Yep.
can really help breathe, open up the airway. I really like simple things like eucalyptus spray in the shower, taking a shower before bed. If you're somebody who has allergies, like a lot of us do, doing that before bed is going to help you be able to breathe better. You'll sleep better. For me, also like having an air purifier in the bedroom, things like that. I live with two very hairy dogs, and that's just part of my life. So I know I
Yeah.
have allergies. So just like being aware of, you know, washing sheets frequently, things that you're not thinking about, like that your air quality and that the things you're sleeping on are clean. And so once you've kind of like covered those bases, then that's where you can play around with like, oh, a nasal strip, or like my favorite is a mute nasal dilator, which
Hmm.
just opens up your nose a little bit. I still love like every time I put one in someone's nose in the chair just to kind of see if it makes a difference for them. And they're like, oh my
Wow.
God, I've never been able to breathe like this before. And I'm like, that's how you should breathe. And your body can just like you can see their body just like relax in the chair when this is easy.
Yeah.
So that's where I would start. I mean, there's so many more things we can do, but those are just like easy starting points to breathe better through your
Yeah.
nose.
Amazing. Yeah, well, I love all of these tips. I think that they're just like so valid. I'm also a huge fan of breath work, like also in other areas, like also like to calm down your nervous system. And it's just
Oh
amazing
yeah.
how much you can do from both like the physiological side, but also like emotionally.
Yeah. I
Um,
love like listening to like a breath work or a meditation before
yeah,
bed. That's really nice.
yeah, definitely. I think this is all super, super helpful. Maybe to kind of like slowly wrap up, like how would people be able to find you if they wanted to like work with you directly, or if they had like questions regarding like their sleep that could be like actually related to this? Like I think a lot of people would most likely think like, oh, like that maybe sounds like me. So how
Yeah.
would people reach out to you?
Yeah, so Instagram's the easiest at Prana with Dr. Kristen. I actually closed off calls because it was just getting a little bit crazy. But if somebody needs help, just message me and I'll send you a link. Most
Hmm.
of what I'm doing now, because there's so many wonderful sleep coaches and things that I can refer to, like you, a lot of what I do is just guide people specifically on this. Like oftentimes it's just a call to help find someone
Hmm.
in their area that treats things like I do, or if they have like those concerns, they're like, shh, what are my next steps? Just guidance, consulting people
Yeah.
on this. So yeah,
Yeah.
happy to try and help if anyone needs help.
Awesome. Yeah, that's super helpful. And I'll definitely link it on everything below. And yeah, I really appreciate your time and also sharing your expertise. Super, super important. So if anybody listening feels like their insomnia could be kind of sleep apnea or just breath related, please do reach out to Kristen or reach out to me if you guys have any questions. Thank you.